Good evening, everyone, and welcome to the special World COPD Day webinar. I'm the Chief Executive of the Asthma and Respiratory Foundation for New Zealand, and I'm going to be your host tonight. The theme of tonight's discussion is living well with COPD, and we have three experts here tonight, which I'll introduce in a moment, and they'll answer your questions on COPD and offer insights into how you can live well with this condition. I'll introduce them in a moment, but first I want to acknowledge Pulse Energy, who are supporting us for this event tonight, and they are a gold sponsor of our Friends of the Foundation program. So thank you so much, Pulse. Without your support, we simply couldn't do a lot of the excellent mahi that the foundation does. So now to our presenters. Our first presenter is Dr. James Fingleton, and James is the Foundation's Medical Director and a respiratory physician at Wellington Hospital. So welcome, James. And did you want to say a few words about your work in COPD?
Yeah, thank you, Letitia, and thanks for asking us to do this today. So I'm a respiratory physician. I work in Wellington Hospital. I've got a background of particular interest in airways disease, so asthma and COPD and the relationship between the two, and spend a lot of my time looking after people with COPD in Wellington. So that's where my interest comes from.
Thanks, James. And our second presenter is Nicola Corna. Now, Nicola is a nurse practitioner in respiratory services at Counties Manukau in the District Health Board there, as a member also of our Scientific Advisory Board. So welcome, Nicola. And could you tell us a little bit about your background in COPD?
Oh, hi, everyone. I'm really pleased to be here tonight and to be able to help the team answer your questions and just enlighten you a little bit more about living well with COPD. Looking after patients with airways disease is my bread and butter. I see them all day, every day, and I've learned so much from my patients and from all the work that I've done, and it's great to be able to pass on some of those hints and tips from my patients through to you tonight.
Thanks, Nicola. And our third presenter this evening is Pauline Mohi, and Pauline has lived with COPD for 11 years now, and so has first-hand understanding of living and managing this condition. Pauline runs several COPD exercise and coffee groups in Christchurch, which we know are so important. Welcome, Pauline. Can you tell us a little bit about how it is living with COPD?
Thank you, Letitia, and welcome, everybody. I'd just like to say it is great that people are wanting to find out more about your condition and that you can live well having COPD, as I certainly found. I was extremely lucky to have a GP who put me onto a better breathing course, and finding out that exercise does help. And that's something that for all of us is a bit hard to believe when you're breathless and somebody says, well, you need to go along and do exercise. You think, that doesn't make sense. But I'm here to tell you that it does, and it really works. So thank you for having me on this.
Thanks, Pauline. So I want to also just take this opportunity to explain how tonight's webinar will work. It's an opportunity for you to ask questions of our presenters. We already have some questions which have been sent through when people have registered for the event, which is fantastic, and we'll discuss those shortly. But you're also welcome to ask questions throughout this webinar. And to do this, you'll need to see there's a Q&A function just at the top or the bottom of your screen, which you'll be able to just select and type in your question. And also you can use the chat access as well for your questions. So I'll keep an eye on the questions which are coming through, and we'll try and get through as many as we can throughout this amazing evening. And once again, I mean, thanks to the presenters for giving up their time tonight to be available to take these questions. So I think that what I'll start with is that with each of the presenters, I just want to hear from your experience, what would be your top tip or couple of tips of how to live well with COPD. And I guess a good place to start is with Pauline. If you can sort of say what's the biggest help for you in managing a life well with living with COPD.
One of the first things that really helped me was being told that nobody died of just being breathless. Once I heard that, that took a load off me. It's I can huff and puff and huff and puff and I'm not going to drop dead. I can now do the things I want to do. And yes, I need to do them slower. I need to do things differently, but it doesn't mean that I can't still do most of the things that I've always wanted to do. So hearing those words really took a load off and made me feel that, okay, I can tackle this, because I'm not going to have any drastic effects from just being breathless. So that was mind-blowing for me. Yes.
Thanks, Pauline. James, what about you from your perspective as a physician? What advice can you give people to better manage their COPD?
I think the general advice I'd probably give is probably the most important thing is we're there to support you, to give you treatment options and to help empower you. It's not our life and our decision making. And so we would generally be wanting to work with you to help you decide how you want to approach things and to give you options. There are, and we'll no doubt touch on some of them in the webinar, there are a variety of different medicines and exercise programs and things that can be really helpful. But I think the most important thing is we're there to help you understand what you're living with and understand things that might help, not to tell you what you should be doing.
And I guess that's sort of what you said as well, Pauline. It's a very individual approach and taking it one step at a time. Nicola, over to you. What sort of key message from your experience and working with people to live a better life whilst living with COPD?
I think it's really important to understand how COPD affects you. So if you can understand how it works in your body, then you know when you're getting unwell, and you know what measures to take. And then, as Pauline was saying before, if you're managing with breathlessness, you know when it's good breathlessness and when it's not so good breathlessness. And being able to explain that to your whānau and the people around you who love you, so that when you need help, you can ask for help. Those things, I think, are really key.
Thanks, Nicola. So we've got some of the questions, and there's quite a few, which is fantastic. Everyone's been really engaged with sending through their questions for this evening's webinar. We'll fire the first one, I think, at Nicola. What do I need to do to maintain good lung function?
Oh, exercise.
That's a nice broad one. Exercise.
As Pauline was talking about, you can't, medications can change your values on your lung function a little bit, but actually I think the question is probably more around how am I managing that breathlessness, and then exercise. Now, we're not talking about running the marathon. We're talking about being able to do the things that you need to do in your daily life in a way that is manageable for you. And Pauline has already touched on that when she talked about doing things a bit more slowly and taking rests and pacing herself.
And Pauline, how did you cope with your diagnosis? I mean, did you find that hard? Was it also not a relief, but actually to have that diagnosis that was something that you could, okay, well, I've got COPD, I'm going to manage it this particular way. How did you cope with that?
I was extremely lucky when it first came up, and the GP I had explained things really well to me, and she let me make up my mind about what to do. My thing was, oh no, all the cells in your body regenerate, da-de-da, and she let me say all this, and then she said, yes, you're quite right, however with lungs that's not so. So she didn't preach at me, she didn't push me, and then she told me about the 8-week courses, and then left me and said, come back when you've thought about it. So it was really good in being able to think about it, research myself some of the things, and realise that she was enabling me, and because she didn't push, I was more able to take up on it. Whereas sometimes when you get someone who says, oh yes, you're a smoker, were you? And your back's up and you switch off. She didn't do that. She listened to me and let me take it forward, which was excellent.
Yes. So like what Nicola was saying, it's that real individualistic approach and
yes.
And steps at your own pace.
Absolutely.
Of working through it. James, we've got a question here. How do people get an accurate diagnosis with COPD?
So you make the diagnosis with COPD with a clinician taking a history, doing an examination, and then confirming the diagnosis with breathing tests. So it's really important that we understand what somebody's symptoms are, what their background is, what they might have been exposed to in terms of dust or industrial exposure or cigarettes, but that also we can do breathing tests to confirm what we think is going on, because there are other lung conditions that can cause some of the same symptoms but will give different patterns on the breathing test. So if we say to somebody that we think they've got COPD based on their story and their symptoms, it's really important that we follow that up at least once, and often more than once, with a breathing test to confirm that diagnosis, because otherwise we sometimes get things wrong.
And obviously there's a close relationship between the primary care and the secondary services and community around this management.
Absolutely, and where tests happen can vary. So some GP practices, some nurses are very comfortable doing the spirometry or arranging for it to be done at their local practice. Others will have to see someone, start trying to address the problem there and then, but then refer to ask someone else to do that test at a later date if it's not immediately available. And that's also absolutely fine, but they should be doing it at some point.
Right.
And it's important that we make that available around the country.
That actually leads into the next question that we've had from somebody. They have said, why do New Zealand hospitals refuse to do scans to confirm a diagnosis? Do you want to take that one, James? And
yeah, sure. So I think what I'd say is the gold standard for making a diagnosis is talking to the person, understanding what's going on, doing an examination, and then confirming it with the breathing test. We don't act, because COPD is a disease that causes narrowing of the airways. It's the breathing test that gives us that diagnosis, not a scan. Sometimes there are people where we're not quite sure what's going on, or there might be something else going on in the mix, such as a condition called bronchiectasis, where you've got damage to the airways that leads to multiple infections. Then you might need to do a scan. But actually, a scan is not the way that we diagnose COPD. So if someone's happy that they know what the diagnosis is, all we be doing is exposing somebody to radiation without a good reason. And whilst the radiation dose nowadays is very, very small with these scans, and so if you need them, they're perfectly safe to have, it's still there. And so the principle is we don't do a test we don't need to do. And so that's why we often don't do it.
Good answer, good answer. I'll see this next question probably start with Pauline, but then Nicola as well from your perspective. Pauline, are there any stages you go through in COPD as it gets worse, or anything that seems to make the COPD worse, symptom-wise, or?
I might add that I've been so lucky in taking on board that exercise is the key, that I am better now than I was when I was first diagnosed. And I know that that's not going to stay that way. However, it's been really great for me to know and to be able to tell other people that exercise certainly helps. You might not think it will, and it doesn't make sense, but it certainly does. And I think for a lot of people, they may not pick up on it because originally, like me, I thought, oh, this is part of getting older, and ignored it for some time. It's just I'm getting older, I need to exercise more, and thought that that was all it was. But of course, the old cough and the breathlessness soon caught up, and yes. But for me, I am chugging along at a good pace.
Excellent. Nicola, have you found that with your experience with people living with COPD, that often it's like almost an initial barrier with the exercise, and then once they sort of getting that started, that exercise?
Yeah, absolutely. And just to sort of tie that in with what you were asking before, is often we see people going along, they've got their diagnosis, they've been introduced to some of the strategies they need to do, put on the right medications, they're managing fine, and then they get sick. And it might be that they get quite unwell, and then and what we sometimes see is almost from a hospital perspective is that they have almost like a little flurry of admissions to hospital. So they get sick and they get sick again, and it's like they haven't quite recovered. But when you sit down and talk to people, what's actually happened is that they've become a little bit more unwell in themselves, and they haven't quite recovered back to their baseline. And so that thing I was talking about before about knowing what's happening in your own body and understanding it has sort of thrown them a bit, and they have to almost like reset at a slightly lower level with slightly lower expectations, and then they hit a period where actually they function fine for a long time, and unless or until they have a little bit of another series of infections. So staying well is so important. And one more comment on that is COVID threw a little spanner in the works there, because so many people stayed at home and they didn't keep up with their exercise. And so they became quite breathless, even without becoming unwell. And they lost a bit of fitness in there.
Thanks, Nicola. We've got a question just come through on the side, which we've certainly got time for as we read through these, and it fits in quite nicely. James, we've got a question from Hawke's Bay. What about patients treated with COPD inhalers referred for spirometry for a diagnosis? Will spirometry diagnose, or what will spirometry show when they're already on treatment?
That's a really, really good question. Actually, interestingly, for COPD, more than for asthma, it's really not a problem, because one of the key things that we want to know in COPD is that even after we've given you an inhaler, there's still some narrowing in your airways. So actually having a breathing test done when you're already on an inhaler isn't a problem, because often if you weren't on any inhalers and you had the breathing test, you might then be given a reliever inhaler to take and then repeat the breathing test to prove that you still had airway narrowing after the inhaler, because that's part of how we make the diagnosis. So being on inhalers at the time of having the test is not a problem at all.
Okay. One of the questions that's come through previously, and I'll hand this over to you, James, as well. Are there any guides on how to manage COPD with other conditions like diabetes and acid reflux?
That's a good question. It can certainly complicate things. Often the right thing to do when somebody's got multiple different things going on, which is really, really common, is to treat each of those individual things as best you can, and then you get the best outcome overall. Now, we sometimes have to be a bit careful that we're not then asking somebody to take too many different medicines at the same time. But for instance, with reflux, you can sometimes get a nasty cough, and it can be sometimes hard to know how much of that cough is due to their airways disease and how much of that cough is due to the reflux. And sometimes you have to sort of treat the reflux reasonably generously and see what you're left with. But you can often get hints about that to do with what the cough's like, how much muck's coming up with it, and things like that. So I think the general principle is you treat each of the individual conditions as best you can and see what you're left with. And that's the same with things like diabetes, because if diabetes is not well controlled, you might get more frequent infections. So you would want to treat the diabetes as well as treating the airways disease.
Thanks, James. This one's come through as well, and I'll go to Nicola first, but someone's just concerned about, is there a link between COPD and heart failure, or is there a crossover? Or
Yes, often people do have coexisting right heart failure and COPD, and it's got to do with the anatomy between the heart and the lungs. And the best thing you can do for managing it is to make sure that you're optimizing your treatment for both conditions. Just as James was saying now, you treat each condition as it comes up. And that's exactly what you do when you've got heart failure. You're treating the heart failure, making that you're taking your right medications, that you're taking the dreaded, water tablets that keep you rushing off to the toilet, and that you're taking your treatment for your inhalers, and then finding out from your clinicians, some of those extra tips and tricks, like, positioning yourself when you sleep, and just being aware of your weight, and all of those, and your fluid intake, depending on the severity of it, and all of those sorts of things. And Pauline keeps talking about the Better Breathing program, and at Better Breathing, they will talk to you about those things, and They will help keep you on the right path. And those little questions that you forget when you go and see your family doctor or your specialist, they'll be able to answer those and help you with those all at the same time.
That's great. Is that helpful, having a little list of questions when you come in to visit, like yourself, Nicola and James? Is it helpful to people have a list?
Yeah, absolutely. Some people have questions that they think they might be going a little bit crazy. They say, oh, I get really claustrophobic when I'm in the shower. I think I'm going a bit crazy because I'm avoiding the shower. And you say, well, actually, that's really common in people who've got quite bad COPD. So, you know, having those little things, don't be scared to ask any of those questions.
I completely agree with that. I mean, I think sometimes those questions mean that we become aware of something else that we can help with, and sometimes it just means that we can answer a question that someone's felt awkward saying or has forgotten to ask in the past. So it's always helpful to have those questions.
That's it. Another good question, which leads on from that for Pauline, actually, is someone said, my family don't understand that my COPD means that things have changed for me. How do I get them to understand? If they want you just to be like before, or?
It's hard for families to understand what you're going through, because most of the time when you're at your worst, they're not there. And I had a particular time once, if I may say it, that I was changing the sheets on my bed, a knock on the door, and I thought, oh God, I was huffing and puffing. I won't answer it. Then I thought I'd better. And one of my sons was there, and he said, oh, jeepers, do I ring an ambulance? What do I do? And I said, no, I'm just changing the sheets. And he said, oh, you don't carry on like that at our place. And I said, I'm not doing anything physical when I come to your place. So your family don't see you generally when you're at your worst, unless you're in hospital, of course. So it is hard for them to understand exactly what you're going through. And a lot of them just want you to sit still. If you just sit still and quiet, you'll be all right, Mum. But it's not like that. So it is hard for them to understand. Yes.
That's a good point, because you're wanting to then do the exercise, and it's no, sit down, don't do anything.
If you keep still and quiet, you won't huff and puff so much. Yes.
Exactly. James, the questions come through. How long can someone live with COPD?
That's a really good question, and it's something that people aren't always willing to ask. Just before I answer it, just to let you know, Pauline, as you've been talking, we can hear you brilliantly, but I'm not sure if you sat forward or sat up or something. So we're now seeing mostly your chin. So if you want to, we can hear you brilliantly either way, but if you either sit back or tilt the screen up a little bit, you might find that we can see a bit more of your face. Either way, we can hear you really well, so it's not that important, but I just thought I'd let you know.
Better.
Yeah, that's great. So people can live for years and years and years, and people can live to a ripe old age with COPD. So the important thing is that we try and stop or slow any decline to do with COPD, and that means if somebody is smoking, we want to try and support them to stop smoking, which can be hugely challenging, but makes a real difference to how fast lungs get worse. And likewise, if they're exposed to other things, dust through industrial exposure or other things, we would try and remove those. And then it's about trying to keep someone healthy as much as possible, both with medications and with exercise. And those things set people up to live for many years with COPD. There's no automatic time frame with COPD, and people can live healthy, can live with COPD and not have their lives defined by the COPD as much as possible, even though, as Pauline said, it can be life-changing.
There's a question which I'll send over to you, Nicola, that's come through on the side, that's asked, what type of exercise is good for COPD?
Any. Just keep moving.
Absolutely.
It depends on you. It depends on how you are. You've all been sent out a great resource pack, and on the Asthma Respiratory Foundation website there is a section where it has the pulmonary rehabilitation or the better breathing networks right across New Zealand. So you can contact them to find out more, or ask to be referred to them to find out more about what exercise you should be doing. But the bottom line is any exercise at all. And when I'm talking to my patients who have just come out of hospital, just been really unwell, the most basic exercise I get them to do is to stand up and sit down from their chair a couple of times every half an hour or so. You know? So any exercise.
Right. Pauline, is there anything that you have found in your home which has made it better living environment? Like, I don't know, we talked about sort of dust or triggers. Have you found anything that you've changed or in that environment that's helped?
Yes, I don't use commercial cleaners. They never seem to be too good for me, and just use ordinary like white vinegar and simple things. All those fumes from a lot of things weren't doing much good at all. I now have a bar stool, which I have at my bench, and when I'm extra breathless, it's just easy to sit on that and peel potatoes and do whatever. So it's been looking at easiest ways for me to do bits and pieces when things aren't so good. But you certainly notice, might I say, that during lockdown and things like that, holidays, when you don't do so much exercise, boy, do you notice it. And it is so hard to bring yourself back up to that point again. It doesn't take long to not do so much to find how hard it is again. So it's just simply keeping up that exercise all the time. It's amazing what a difference it makes. You don't realise until you stop, and then you think, oh my gosh, this certainly works.
Good advice. Good tips too. James, a question's come through. What's your opinion of antibiotics to prevent COPD flare-ups?
Yeah, this is something that's been looked at in some detail. They have a place in some people. It's a balancing act, because if we use antibiotics in everybody who has an occasional chest infection related to COPD, two things happen. One, lots and lots of people get side effects from the medication. And two, the bugs become resistant to the antibiotics and then we lose access to them. So we are a little bit careful about them. There are some people who are having frequent severe attacks, which we believe are due to bacteria, that will benefit from having antibiotics to prevent future infections. But it's actually a very, very small proportion of people with COPD. In fact, it's a small proportion of people that we see at the hospital with COPD, let alone in the general population. So they have a place, but it's probably only in quite a small number of people. And sorry, the one other thing I'd say with that is we'd usually get there by having looked at things in a certain amount of detail first, because if we're considering it, we're also thinking, is there something else that's meaning that person's frequently having infections? Do they have that other condition I mentioned called bronchiectasis or something else? And that's when we go, how sure are we about what's going on? And we'd usually want to pause and think about that before we reach for antibiotics.
Good point. Nicola, any tips for dealing with the anxiety that comes with COPD? You've talked about the breathless clinics, of course. That anxiety feeling and the breathing techniques, or?
Oh, you know, we could actually sit and talk for about an hour just about this by itself. So this is a real curly question. And again, it comes back to the individual person. The really short thing I suppose I could say about it is that when I talk to people about managing anxiety and their COPD and breathlessness, I say if you can find a balance between what's going on up here and what's going on in your lungs, then you'll come right. And I think it does come down to just being able to understand what's happening in here, being able to have the confidence that, as Pauline keeps mentioning, you know, she gets breathless, but she knows what to do to manage to get herself okay. If you have the confidence that you can do that, it will decrease your anxiety dramatically. There are medications, but we reach for them after quite a lot of considerable thought and process. The first thing we do for it is it's all in your resource pack that you've got on the COPD action plan. There's a little breathlessness plan, and that will help manage anxiety as well as your breathlessness. So that's the very, very short version.
Exactly, it's a short version. It probably leads into another question which has come through, which would be good to hear from each of you, and I'll start with Pauline first. From our own experience, are there any natural therapies that help with your COPD? It's probably quite an individual thing, but anything from your perspective that's helped, Pauline?
Not really, other than I dare say, I always say to people, the most natural therapy is getting out and sitting in the sun as much as you can. That calms you down in every way, as well as all the things that it, good things that it does for you. Yes. I haven't really gone into anything like that. Just good healthy eating, exercise, to me, what matters is.
Good life advice, Pauline.
Glad to hear of anything if somebody's got some magic there.
Nicola, do you?
Nothing that I've had patients bring me all sorts of things over the years, but nothing that anyone else that they would sort of swear by was helpful. It was more along the lines of, is anything in this going to interact with my medications? And I think that's a really important point to consider. If you look on the New Zealand COPD guidelines that we wrote, there is a whole section on non-pharmacological things, and the plain language version of the word non-pharmacological is non-medication stuff to do, and it ranges from using a fan, breathing techniques, relaxation, as Pauline's talked about, going into your happy place. There's a whole lot of techniques there which I think come above anything that you could go and spend money on. Yeah. Fantastic.
And James, same to me, I suppose, if there's interactions with anything, that's something to be concerned about, I guess.
I'd echo what both of our other speakers have just said. So the exercise, using a handheld fan for that feeling of movement over the face. Obviously, exercise generally to improve breathlessness, not necessarily at the moment when you're feeling overwhelmingly breathless and anxious about it. The breathing techniques that are covered in the pack, handheld fans, things like that, are the most important things. I'd agree with Nicola that the main thing with other medications is talking about side effects. There are no natural remedies or herbal medications that have been shown to improve these symptoms. So there's no evidence that they work. People will make their own choices what they choose to do, but the main thing we would encourage them to do is to discuss it with their doctor or nurse so that they can check that they won't interact, because some herbal medicines and other medicines or other tablets can interact with medicine, so you want to be sure that there's no potential downsides to it.
And your pharmacist is key there. There is actually a program that all the pharmacists have got access to, and they can pop in whatever it is that you're on medication wise, as well as your supplements, and see if there's any interactions. So always double check that with them. Yeah.
That's some really good advice with the pharmacist too. For James and Nicola, we've got a question on the side come in. From a respiratory nurse perspective, or practice nurse perspective, we all want to educate our patients how to breathe normally, breathing recovery and sputum clearance. I cannot find anywhere where I can formally train or get accreditation for this. Is there a course in New Zealand?
Well, the Asthma Respiratory Foundation run courses. Don't they, Letitia?
They do, yes, they do. Some excellent courses.
From a personal perspective, we, in our department at Middlemore, we do a lot of inter-department training, and we do study days, and that's the sort of thing that I'd suggest that you reach out. If you're part of a local a practice nurse network, you could ask one of the local respiratory nurses to come along as a speaker to your group, and or respiratory physiotherapist, and ask them to give you some tips and train and do that sort of thing. So the Asthma Foundation have their courses which are formal accreditation, but informal education is also really useful.
Thanks, Nicola. And I'll send this one now to James. Are there any new treatments available, James, for COPD that we should be aware of? For some reason that's stalled. I'll let James come back on. Nicola, are you aware of any new treatments for COPD?
There's always stuff that's evolving in this area. Some of it can be quite experimental, sort of some of the surgical type of options. There was a question that had come through around a biologic treatment, which is actually used for managing asthma rather than COPD. There's not been any evidence about it in terms of managing COPD. But sometimes people have COPD and asthma concurrently. This is where things can be a little bit confusing. If you hear that your friend has got some sort of particular therapy and they've got the same condition as you, you actually may not have the same condition. You know, they may have something else going on. In the COPD guidelines, we do touch on some of the treatments which are available for COPD, which are only applicable to a very small number of people. And we talk about things like lung volume reduction surgery, transplant, those sorts of things. Again, you'd have to speak to your GP and ask about being referred to a specialist centre. And again, James was talking earlier about things like antibiotics, and that a lot of investigations need to be done in those people before they get to that point. It's exactly the same with some of those newer sort of treatments.
Right. Right. I think James is just trying to log back in now. A question's just come through, Pauline, for you. Do you self-monitor your oxygen levels and heart rate?
No, not. I mean, I got a what do you call it, oximeter when COVID came, but I really use it. No. But I guess in talking about the things you do, the pursed lip breathing, calming yourself down, and also the fact that for so many of us, we breathe in the top half, and just the simple learning that unless you breathe right out, how can you fill up and have that air? That too was a brilliant thing to click in your head. Well, of course I can't be calm in that if I'm breathing away up here. So there are lots of things, simple things that we can learn to breathe better and calm yourself. Yes.
Thanks, Pauline. And James, we've good to have you back in and zipped out and zipped in. We were just talking about new treatments, and Nicola was talking about you know, the role of some of those, like Nicola. Do you have anything to add on what new treatments have evolved with COPD?
Yeah, so that's an area that we're very interested in. The best evidence has been around the inhalers and what combinations of inhalers work well. As Nicola touched on, I only caught the second half of your answer, I think, because unfortunately the system, for whatever reason, kicked me out. But medications like Nicola are being looked at in particular subtypes of COPD. So some people with COPD have a particular pattern of inflammation in their lungs that means that we thought those medications might work. However, the studies so far don't actually show much benefit in people with COPD, so nobody's using them in that setting. It's still something that's being looked at, whether it might have a role when people are having particular types of flare-ups that take them to hospital. But at the moment, we just don't know, and that's still a subject of research. So there's a lot of interest, but some of the patterns of inflammation for a lot of people with COPD are different to some of the patterns for some of the people with asthma. And so what works for one thing doesn't automatically work in the other.
And are there any interventional treatments, James, around COPD?
Yeah, so with people with COPD, one of the things, and it's not something we touched much on before, people will often be far more familiar with the terms of chronic bronchitis and emphysema, which are terms that have been around for longer. And COPD sort of encompasses all of those things. So some people have more airway narrowing. Some people have more lung destruction from tobacco smoke and other things. And that lung destruction, that emphysema, can affect some bits of the lung more than others. And so for some people, that lung destruction then leads to a big expanded area of air that's no use to the person, but compresses the rest of the lung. So some people can have either surgery, less commonly nowadays, or occasionally special one-way valves put into that bit of the lung to try and deflate that bit of the lung and allow the rest of the lung to work more efficiently. So those things are called endobronchial coils or endobronchial valves. We do them very occasionally in New Zealand. The reason we don't do them more is because, unfortunately, like lots of treatments, they come with potential downsides. So they only work in a small number of people, and so you have to be very careful about who you do them in. And unfortunately, they can cause complications in terms of infections and other things. So you want to be very careful about selecting who you do them in. So yes, there are, but they're only right for a few people.
Thanks, James. We're coming towards the end of our session shortly. So I'm really hope everyone's found the discussion so far interesting. And sorry if we haven't been able to answer some of your questions. Hopefully we have. But I would encourage everybody to go and have a look, as Nicola's mentioned, go to the Foundation website for more information and resources on COPD. And we'll be sending out more COPD resources, as well as this video recording will be available on webinar as well for all attendees this week. Please feel free to share it with anyone you think may be interested. That's really important. And you can email us at marketing@arfnz.org.nz for information. I'd also like to thank our marketing team, Sam and Charlotte, who are behind the scenes, who have helped put this together. So thank you so much for that. But just before we go, it would be really good just to have a brief final word from each of our guest speakers as a wrap up, to sort of say what's the top 10 the top advice, I guess, you could give from your perspective of people to live well with COPD. And we'll start with Pauline first.
Okay, for me, it is to do the better breathing courses, which are available all around New Zealand. And when you really make progress with that, keep it up by then joining an exercise and coffee group, because you're joining with like-minded people. So you share your experiences, you learn from each other, and it not only helps your physical health, it helps your mental health as well. So thank you for allowing me to be on here, and I hope people have learnt some good things from it. Thank you.
Thank you, Pauline. Nicola.
As I said before, learn a bit more about your condition and how it affects you. If you're smoking, stop. Kick the guilt in the teeth. It's a waste of time and energy. And just join, as Pauline was talking about, get exercising. Join your local better breathing program, and meet some people who are in a similar position as you, because you'll find that more than anything else is just very, very supportive and encouraging.
Sounds like that support network is really, really important to live well. And James, top sort of tip or advice to leave people with?
Well, the first thing I'd say is the advice that's already been given is the most important advice about the exercise, about the support networks, using the better breathing and exercise classes. And yes, absolutely stopping smoking if you are smoking, but also leave guilt behind. It's not helpful. And there is a huge element of luck to who has this condition and how badly it affects people. So that's really important. So guilt, forget it. It's not going to help. Easy for me to say, harder to do. But from a medication point of view, don't be afraid to ask someone to show you how to use the inhalers. We're sometimes too quick to write a script and too slow to actually explain how to use them. There are different inhalers. So if you find your inhaler fiddly, chat to your doctor or the pharmacist or a nurse about whether there's a different one that you might find easier to use, because there's a few different ones where the medicines all work well. So it's about us finding an inhaler that works for you. So that's maybe the only thing I'd add to what's already been said. And yeah, feel free to bring the list of questions in to talk to us. At least then we know we're addressing the things you want to talk about.
Good advice. Thanks, James. So many thanks to our three fantastic speakers tonight. I hope it's been really informative to people, and do reach out, go onto the Foundation website. There's a lot of information there, as Nicola has talked about. A big thank you to Pulse Energy for helping support us with this webinar tonight. And yeah, thank you so much for giving up your time, freely presenters. So we'll namihi moeha and Paul Marie. Good night.
Good night.
Night.